Great. Well, thank you so much, Naomi. First, I just want to say I'm really excited to be here, and I really appreciate that meditation to start because when I do give a presentation to a group, I get really excited, and sometimes it's nice to have that meditation to just slow the pace down a little bit. But yeah, I'm super excited to be here, and I'm going to pull up my presentation now, and then definitely jot down any questions that you have so that we can make sure we get those answered at the end of the presentation. Okay, how does that look?
Looks great.
Good.
Okay, great. So as Naomi said, I'm a dietitian here, an oncology dietitian nutritionist at the UCSF Cancer Center. I've been here for 17 years. So I've known Naomi for 17 years and known Mary for quite a few years too. And I'm here to talk to you today about nutrition, which is my area of specialty. And we have oncology dietitians that are part of your care at the UCSF Cancer Center. So if you want an individual consultation after this meeting today, we encourage you to ask for a referral to our practice through your oncologist, and there's no insurance or billing required. It's part of your care. And we'd love to see you for an individual consultation. So what I would like to talk about with you today is generally exploring the anti-cancer diet. And so I'll talk a little bit about research on diet after cancer diagnosis, what is known, what are important foods to include and foods to limit. I'm going to describe the ketogenic diet and review dietary supplements, just a few that may aid in memory and cognition and fatigue management. So first, just to start off, the American Cancer Society's Nutrition and Physical Activity Guidelines for Cancer Survivors. These are evidence-based, cancer-specific nutrition and physical activity recommendations. Their most recent guidelines were published in 2022. And you can see the recommendations there. Number one is to achieve and maintain a healthy body weight throughout life. Number two is to be physically active. And it sounds like you talked about physical activity last week. And number 3 and 4 dive into what they recommend for a healthy eating pattern. Foods that are high in nutrients are recommended. So a variety of colorful vegetables, beans, peas, other plant-based foods, fruits, in particularly colorful whole fruits, whole grains. And they recommend to limit red and processed meats, sugar-sweetened beverages, and really any highly processed foods and refined grain products. And then overall, it's best not to drink alcohol, but for people that do choose to drink alcohol, limit consumption to no more than 1 drink a day for women and no more than 2 drinks a day for men. And so the evidence for these recommendations primarily comes from studies on breast cancer, digestive system cancers, prostate cancer, lung cancer, and gynecological cancers. They really only mention one study on brain cancer in this whole document, and it was suggesting the benefits of physical activity on mortality outcomes for malignant glioma. And they also recommend that people undergoing active cancer treatment consult with their healthcare providers to really individualize all of these recommendations around physical activity and what's appropriate, what type of diet interventions are appropriate. But I wanted to find more. I'm always looking for more for specific types of cancers. And so looking at research on what do we know about diet and lifestyle modifications that could improve the quality of life and overall survival with brain cancer, I was looking at different studies and came across this review. And I have to say, overall, there's very limited information out there, and we need more research in this area, is what the number one thing I would say. We need more research in this area so that we can give tailored recommendations to this group. But what this review found, the authors found small studies associating lower blood sugar levels and healthy body weight being associated with longer progression-free and overall survival in people that had glioblastomas. They also included areas of research of interest for furthering the research on the ketogenic diet, calorie restriction, and short-term fasting, and discuss the research that's underway so that we can better understand if these interventions can be helpful. So I'll be talking a little bit more about that later. So overall, when we think about, how can nutrition help after a cancer diagnosis, and really thinking about its benefits in terms of supporting the immune system, promoting overall wellness, and that's everything from energy to physical functioning to lowering the risk for other chronic conditions, treatment-related side effects, certainly improving energy and potentially enhancing treatment and making it more effective. And that's really how we want to focus on nutrition after a cancer diagnosis. So I like to think about, how can we dig deeper and look at potentially the cellular processes that are linked to cancer? And how can we use nutrition to address some of these, some people call them root causes of health problems and cancer. And these are the cellular processes that are linked to food, nutrition, obesity, and physical activity that influence cancer development or cancer progression. And so how can we use nutrition to decrease chronic inflammation that can encourage cancer, boost our immune system, metabolize carcinogens, et cetera, to really think about making our body more of an anti-cancer environment. And so that's what I want to focus on with you today, is thinking about these core nutrition strategies, things that can potentially address some of those cellular processes. And so number one is to build the diet around colorful plant-based foods, nurturing the gut microbiome, including high-quality protein and beneficial fats, staying adequately well hydrated, and then really slashing consumption of the added sugars, the highly processed foods, and alcohol, and using nutrition to optimize treatment. So the Mediterranean diet, I love the Mediterranean diet food pyramid, because this diet is got physical activity and being social with others, enjoying meals in a social situation as the base of the pyramid. And then it's characterized by an abundance of plant-based foods. So you'll see lots of colorful plant foods, vegetables, fruits, mostly whole grains, olive oil, plant proteins, beans, nuts, herbs, and spices as really the base, with a regular intake of fish, and then moderate portions daily to weekly of poultry, eggs, and dairy products. At the very top, meats and sweets are included less often. And then if drinking at all, wine is in moderation. And so it's a really nice graphic of what a general plant-based diet looks like. It's not necessarily no animal foods. That's not the goal of the plant-based diet, but it's to choose mostly plant foods. And so this picture shows that, on a plate, 3/4 of the plate is coming from plant-based foods. And it's really a way of loading up on nourishing compounds, so protective substances that can actually strengthen that anti-cancer environment in the body. And these are going to include things like vitamins, minerals, fiber, phytonutrients, and prebiotics. So let's talk about phytonutrients first. So phytonutrients, the word is, phyto is the Greek word for plant, so it's a plant nutrient. And they're found in plant foods, and specifically in colorful plant foods. They're natural plant compounds that are in the plant to protect it from the sun and from pests. So it's the natural sunscreen and natural pesticide that's in the plant. And then when we eat them, they provide us with health benefits. So these phytonutrients do things like act as anti-inflammatory agents. They act as antioxidants, protecting our cells from the damage that can lead to, the development of cancer. They are immune boosting, and they help our liver to detoxify carcinogens. And they've also been shown to support our healthy gut bacteria, known as the gut microbiome. So these phytonutrients have tons of important activities for the plants, but they have tons of important activities for us when we consume them as well. And one of the identifiers of the phytonutrients in plant is the color. So when you see different bright, dark, deep colors, those are the phytonutrients. They also give plants the smell characteristic, tastes, flavor, in addition to the color. These compounds work synergistically with each other and with compounds in other foods. So one plant food, like a tomato, for example, doesn't just have one phytonutrient. It has many phytonutrients. And research shows that these compounds actually amplify the effects of each other. So when they're consumed together, it's like a multiplication relationship. 1 + 1 doesn't equal 2, but the benefits go from 1 + 1 equals 5 or 10 because they help us absorb them better, help activate the compounds better. So when we study the compounds in isolation, such as taking it in a supplement where you're just getting one compound, we don't really see the same benefits as when people are consuming them in the foods or when they're studied in a lab with all the compounds in that food together. So ideally, we're getting these from foods, not supplements. And we don't just need to think about fruits and vegetables as sources of these phytonutrients. I mean, they are a great source, but they're also going to be in herbs and spices, which are very potent sources of phytonutrients. When you hear about green tea being beneficial, or turmeric, or any nut or seeds, flax seeds, chia seeds, some of the components in there are the phytonutrients. So one of the things, that we talk about a lot to people is trying to eat the rainbow, making it a target of getting at least 4 colors in the diet every day. And you'll see from this picture here that has the rainbow, and it shows all the different colors of the rainbow and the different benefits. And even white is included. So the white vegetables are mostly your allium vegetables, like your garlic, onions, very beneficial. Or cauliflower. But the goal that this table is recommending is actually to try to eat 2 foods from each color group daily. And I think that's a great target over time, but I usually start with, if you can get 4 colors in your day, that's a great start. And one thing about the phytonutrients is that there are, this chart is just really busy. The point is to show you that there are so many phytonutrients. There are 10,000 in the food, in foods that have been discovered to this point and counting. We're still learning more and more phytonutrients in our foods. And so really looking at a variety and minimally processing, so something like a whole grain actually is a pretty good source of phytonutrients. But as we process them into, say, a donut, for example, well, you're going to lose all the phytonutrients. So we want to focus as much on whole foods to maximize the benefits. And a lot of people, are asking, what about organic? Is organic, how important is that with fruits and vegetables? And, our current evidence is really unclear on how important it is to eat organic. But we do know that there's this list called the Dirty Dozen, which I have up here. We've got the Dirty Dozen and the Clean 15. And the Dirty Dozen are the top 12 vegetables and fruits that, when they're grown conventionally, they have the highest levels of pesticides. So buying these 12 organic will lower the pesticide exposure from fruits and vegetables by about 90%. So these are the 12 that I really prioritize getting organic. And some studies show that organic produce is actually higher in those phytonutrients because the plant has to protect itself more from the environment. And so it kind of strengthens its own defense mechanisms. So definitely can be some advantage. But prioritizing is in terms of availability, affordability, these dirty dozen are the ones that I would prioritize the most. For a lot of people ask about, are frozen vegetables okay? Fruit, canned fruits or vegetables, and definitely frozen is a great option when fresh is not available. So when they take, when they make frozen vegetables or package frozen vegetables, they pick them when they're at their ripest, and then they go through and put them into the freezing process. So it really locks in the nutrients. So frozen is a really good option. And so definitely not think of that as like a second best. The next big beneficial compound, that we get from eating plant foods is dietary fiber. So fiber is all of the undigestible part of fruits and vegetables, whole grains, beans, nuts, and seeds that passes through our digestive system and has quite a few health benefits. So you'll see from this chart up here that it can do things like bind to carcinogens and help us eliminate them in our stool. It can improve our blood sugar, so how our body responds to meals in terms of our blood sugar effect after we eat. And so when we're thinking about lowering blood sugar and that having benefits, eating more fiber is one strategy. It also improves us feeling full and helping us manage weight better. We're eating a higher fiber diet. There's heart health benefits. There's benefits for constipation. And there's a lot of benefits with fiber feeding the good bacteria in our gut. And so the average American diet is pretty low. We call it the standard American diet or the SAD diet. You might have heard of that before. It's fairly low in fiber. It's estimated to be at about 15 grams of fiber a day. And the recommendations are actually to target more of a 30 to 45 gram of fiber intake per day. And so with a pretty good amount of vegetables, if half of your plate is vegetables at least 2 meals, potentially some fruit and some beans throughout the day, or a serving or two of whole grains, the target amount of fiber will be about 30 grams of fiber a day, 30 to 40 grams, without taking a fiber supplement or anything like that. So with grains, there was a little part of that plate, about a quarter of the plate, where we had a starch on the plate. And so with grains, when we pick them naturally, pick them out of the ground, they're going to have quite a few nutrients when you have the whole intact grain. The bran and the germ are really where all of the nutrients are, outside of the carbohydrates and the little bit of protein that's in grain, which is mainly the energy. So to get the benefits of the phytonutrients and the fiber, we're looking at including whole grains as opposed to refined grains. And so there's a list up there of a variety of different whole grains. If it's something like wheat and it's a bread product, it would be whole or sprouted. But getting a variety of grains, so things like quinoa or wild rice, oats, etc., is a really nice way to get a variety of health benefits. For example, oats are really rich in prebiotic fibers, which are good for our gut bacteria, whereas quinoa is a richer source of protein and iron. So thinking about, rotating your grains and getting a variety of grains is recommended. Now, if you're eating things out of a package, it's a little bit easier. If you're buying quinoa or wild rice or something, you can see that it's a whole grain right there. But when you're buying something like a bread or a cracker or cereal or something like that, the nutrition facts label is very handy because, what they put on the front of the package, the color of the food really doesn't tell us much about, whether this is a whole grain, if it's a good source of fiber. So I highlighted the ingredient list. That's where I first look, and always look that the first word says whole or sprouted. If you see the word enriched flour or wheat flour, it's not actually a whole grain. And so the first ingredient is best to be whole or sprouted. And then I also look at the fiber content. So we want something with a decent amount of fiber. So 3 or more grams of fiber per serving is a good target. So the second strategy is to support and nourish your gut microbiome. So the gut microbiome is the 100 trillion, there's 100 trillion bacteria living in our digestive system, about, it's not exact, but that's about how much. And it really, learning more and more about the gut microbiome and how it influences every aspect of our health. So dysbiosis is basically when there's an imbalance of the bacteria of our gut. That could be an abundance of unhealthy bacteria. It could be just less bacteria in general, variety of ways that we could have dysbiosis. But overall, it's an imbalance of bacteria within the gut, and it's linked to various health conditions, including things like diabetes, depression, obesity, heart disease, and certain types of cancer. So when we think about, our overall health, nourishing our gut microbiome is going to be a key strategy. And about 70% of our immune system is in our gut. And so a big part of that is the gut microbiome. And so when we nourish these bacteria and we, strive to keep them healthy, that's really one way to strengthen our immune system. And the good news is, you don't have to eat different foods. Plant foods nourish both you and your gut microbes. And so studies show that individuals consuming diets low in fiber or a Western style diet, they tend to have reduced microbial diversity, which is associated with more chronic health conditions and health problems, versus a higher fiber diet, or the Mediterranean diet, is linked with an increased diversity and more of a richness in the gut microbiome. So pretty much all of your plant foods are a good option, for nourishing the gut microbiome, but specifically foods called prebiotics. Prebiotics are specific foods that your gut bacteria really thrive on, and what they eat and ferment to produce substances like short chain fatty acids, which are very nourishing for the gut. Ideally, looking to include at least one source of a prebiotic rich food daily. And if you're doing that already, even striving to get one prebiotic rich food at each meal. And so the foods that I have listed here are specifically, rich prebiotic rich foods. And you'll see dark chocolate is on there. So that's actually a source of prebiotics. So dark chocolate would be something that's greater than 72% cocoa, kind of the higher the better to get the benefits. But there's, seeds and nuts, specific fruits and vegetables and whole grains that serve as prebiotics. The third strategy is to balance your plate with high quality protein and beneficial fats. And so this is a key strategy because, yes, we want to really amp up the plant-based foods, but we also want to think about how the meals we're eating can impact our blood sugar levels. And so because we know that having potentially a more normal or low normal blood sugar, may have some particular health benefits here, we want to think about combination meals and snacks that help maintain lower, more stable blood sugar levels. And this diagram shows that carbohydrates have the fastest and largest impact on our blood glucose. And so what we're going to see is if something's just a carbohydrate meal, just carbs by itself. So say, certainly if it was a liquid carbohydrate like fruit juice and there was no fiber or anything with it, we would see a much greater spike and drop of blood sugar. But when we combine a carbohydrate-rich food with protein at the same time, which is going to have a more moderate impact, about 50% turns into glucose, and the rise and fall will peak at 2 to 4 hours after eating protein. And if we also combine that with fat, which has a very low impact on our blood sugar, only around 10% turns to glucose, and it releases very slowly over 8 to 10 hours, we're overall going to have what we call a low glycemic load meal, and that reduces blood sugar spikes after eating. So, if I talk to somebody and they're snacking and they, really need a snack, they might want to eat some, crackers. So one thing would first be, okay, could we make it a whole grain cracker or maybe a seed cracker. A seed cracker is going to typically have a little bit more protein and fat. And then can we add something to it that has some protein and fat, like a nut butter, like spreading some almond butter on it? Because overall, that combination is going to lower the glycemic load, and we're going to get less of a spike in blood sugar after eating when we pair that up together. So what are high quality proteins? And here are some examples. So we've got lentils and beans, organic soy foods, nuts and seeds, low mercury fish and seafood. And so low mercury fish tend to be smaller fish. Those things like sardines, trout, herring, salmon is low in mercury. If you're eating tuna, it would be a skipjack tuna versus like an ahi or an albacore tuna would be a low mercury fish. We've got organic skinless poultry, pastured eggs, grass-fed and wild meats, and organic fermented dairy. So these are kind of our highest quality protein choices. And as I mentioned before, protein helps stabilize blood sugar, which gives us more energy. It prevents the highs and lows, so we get a more stable energy throughout the day with protein at meals. And it's a building block nutrient, so it helps maintain muscle mass. It helps with healing. It helps with maintaining blood counts and supporting our immune system. So things like red blood cells, white blood cells. It's important to eat enough protein to support those numbers. And it can come in a plant or animal variety. So we know that these high quality are definitely more expensive. So I get that. The grocery store is very expensive these days, but the quality can really make a difference. So whenever possible, I do encourage trying to see ways that you can fit this into your budget. For example, grass-fed meat or wild game meat, if you're eating red meat, it's leaner and it also has a higher amount of omega-3 fatty acids and lower levels of omega-6 fatty acids, which is one way to help with decreasing inflammation, is to get more omega-3s and less omega-6. So when you can get a grass-fed or wild game meat, that's one way to, get that benefit. If it's not an option, it's just totally cost prohibitive. I would recommend leaning on more plant-based proteins and also going for just the leanest cuts possible. So that's one way to kind of minimize the excess omega-6 fats. Is if you have a chicken breast that's got no skin, the fat is going to be very low to begin with. So the omega-6 and omega-3 is going to be very low to none, in a very lean piece of meat. So that's what I would do, what I would focus on if, the higher quality is not available. And you'll see the picture here. Again, we go back to a little protein goes a long way. So the protein is only taking up about a quarter of the plate here. We've got plenty of plant foods, a little bit of high fiber, starch, and then some good healthy fats with the avocado. It's really all about the balance. The nourishing fats, I mentioned already, how important they are for helping to stabilize blood sugar. Fat is also important for helping us absorb certain vitamins. There's fat-soluble vitamins like A, D, E, and K, which we need fat in our diet to absorb. And a lot of the phytonutrients are actually fat-soluble. So again, talking about the tomato, the lycopene, which is the red pigment, is a fat-soluble phytonutrient. So if you have the tomato with olive oil or with avocado, the lycopene absorption improves significantly. So the nourishing fats are primarily going to come from omega-3 fatty acid rich foods. These are essential fats, and we get them from cold water fatty fish, such as salmon, sardines, black cod, trout, and herring. And to get an adequate amount of the long chain omega-3 fatty acids, it's necessary to do about 2 portions a week. So targeting, somewhere between 8 to 12 ounces of cold water fish a week. For non-fish eaters, I do typically recommend an omega-3 supplement just because there's not there are plant sources. We do get omega-3s from ground flaxseed, walnuts, pumpkin seeds, and chia seeds. And those are very beneficial and good to include, every day. So a small portion, couple tablespoons of one of these nuts or seeds daily. But our body can't utilize those plant forms of omega-3 quite as well as it does the long chain that we get from the fish that have already processed those. So that's where having the fish, I think, is a key element to an anti-inflammatory diet. And then the omega-9, which are our monounsaturated fats, primarily come from extra virgin olive oil, olives, Brazil nuts, almonds, avocado oil, and macadamia nut oil. So these are great sources of oils to use for cooking or certain nuts, etc., to get, some good healthy fats. What are the dietary fats to limit? And I mentioned the omega-6 to omega-3 pathway previously and how it affects inflammation. So our omega-6 and omega-3s are both essential fatty acids, but they compete with each other to be utilized, processed, and functioned in the body. And so the standard American diet is very high in omega-6 fatty acids, and it's very low in omega-3 fatty acids. So that's the balance is tipped. We need to have those more in balance so that our body can utilize the omega-3 fatty acids to support our immune system, support brain health, have an anti-inflammatory effect. And we can do that by lowering our intake of omega-6 fats because we will get them from our diet very easily. Some of the most omega-6 rich foods that I would recommend to limit would be the certain oils, sunflower, safflower, cottonseed, and corn oil. Generally processed foods. So if you start looking at a lot of packaged foods, and I'm not talking about a prepared food where you go to the grocery store and you buy some pre-cooked lentils that are vacuum sealed and that's a prepared food. There's nothing added. But when you start looking at things and there's, multiple ingredients, typically they're going to be using one of these omega-6 rich oils because they're less expensive. And so a lot of people get their omega-6 fatty acids in excess from, eating at fast food restaurants, eating a lot of processed foods. And then you will get a higher intake of omega-6 with regular eggs, so not the pasture raised or omega-3 eggs. The yolk will be higher in omega-6, and then the conventionally raised meats. Also recommend to limit animal fats, so primarily excess intake of dairy fat or fat from meats, because the saturated fat tends to promote inflammation. It blocks this metabolic pathway. So it can block some of the conversion of the omega-3s into the active form if we're eating an excessive amount of saturated fatty acids. And then we want to avoid partially hydrogenated oils, which luckily for us, most of that is out of the food chain. So we don't really need to worry about that too much, but they're also known as trans fats, which absolutely block the body's ability to make this process happen. So overall, we're focusing on more plant foods, balancing our blood sugar with protein and good fats. And then hydration is really important. So our bodies are anywhere from 55 to 75% water, depending on the size, the age. And water has many important functions in the body. You can see them there. It aids in our digestion. It helps deliver oxygen to our cells, regulate temperature. It's lubrication and moisture for all of our membranes and joints. And it helps us flush waste out of the body. So, what is a good appropriate amount of fluid? It really varies from person to person. One target that's recommended is to take your weight in pounds divided by 2, and that's about how many ounces of fluid to target on a daily basis. So 150 pounds, target about 75 ounces of fluid a day. And the best fluids to hydrate with generally are water, herbal teas, broths. But that being said, I would say this is an individual. Some anti-epileptic medications can cause hyponatremia or low sodium levels. And so people on those medications actually need to drink more fluids other than water that have sodium in them, because their sodium levels can go very low. And so that's one time where I'd say this is an individual, recommendation of how much fluid and what types of fluids. Or if somebody's losing a lot of weight, we might want to target more nutritious liquids like a smoothie or a blended soup that's going to provide hydration, but could also provide maybe some protein and some good fats and some calories just to help maintain weight. The last core strategy that I want to focus on is limiting the added sugars. So, a lot of us are already thinking about sugar. We know sugar is, not helpful for the body. It doesn't really provide any necessary nutrients. It's not to say don't ever have a treat, but, we're all striving to eat healthier. And maybe you're not eating desserts. Maybe you're not, adding sugar to foods, but there's a lot of hidden sugar in foods. And this is another reason that limiting processed foods can be helpful, because everything from, yogurts to drinks, even drinks that sound healthy, like matcha green tea lattes at the coffee shop. Well, they oftentimes have, syrups pumped into them or that type of thing. And some of our plant-based milks, like our almond milk or soy milk, can have a lot of sugar added. Sauces can be notorious for having a lot of added sugar. So kind of looking along those lines and going a little bit deeper as opposed to just, limiting desserts, but really looking at the labels to figure out how much sugar, added sugar, is in this food. This is a sauce. It's like a red chili sauce, and 2 tablespoons actually has 19 grams of added sugar. And so a lot of times if we're not looking at labels, we wouldn't know necessarily. It might taste a little sweet. Sometimes it doesn't even taste, things don't even taste very sweet, but they have a lot of added sugar. So I would recommend looking at the labels and, general target, of course. I would love to say, well, none of us should have any added sugar ever, on a daily basis. That would be ideal. But realistically, a good target is to keep added sugars below 25 grams per day. And that's from all sources. So that could be from food products that you're eating. It could be from a teaspoon of honey or maple syrup that you're adding to something. Yeah, that's 4 grams of added sugar. So it's not a lot, but it kind of all adds up. So thinking about the whole day, and generally, trying to limit the added sugar. So that way, when you want to have a dessert from time to time, your sugar intake is very low. The Mediterranean diet, I just wanted to kind of close this out before we move on to a different topic, but the Mediterranean diet is something that's been an area of research in studies called the MIND diet. And the MIND diet is a diet that's been developed with combining the Mediterranean diet with the dietary approaches to stop hypertension, or the DASH diet. And they've been studying this for neurodegenerative delay. And could this diet be beneficial? This is not specifically with brain cancer. It's following people, older adults, for 10 years, people that were free of dementia at the time of enrollment. And, I think there can still be some beneficial takeaways from this information, is that the results of the study produced 15 dietary components that were classified as either brain healthy or brain unhealthy, based on following these people, having them fill out diet surveys every year, and then correlating, their diet scores with who developed cognitive decline and who didn't. And so you can see here, things like green leafy vegetables, other vegetables, nuts, berries, beans, whole grains, fish, poultry, olive oil, and wine were beneficial. I think for people with a cancer diagnosis, I would probably eliminate the 1 glass of wine per day recommendation. I think we could probably do better avoiding that or limiting that even further. And then they found that the unhealthy foods were red meats, butter, and stick margarine. They recommend less than 1 tablespoon per day, cheese less than 1 serving a week, pastries and sweets limit, I think they recommended limiting it to 5 servings or less per week of a sweet, and then fried foods less than 1 serving per week. And so I just kind of like to bring this up because a lot of these strategies, thinking about it as an anti-cancer strategy, can also be good for, a lot of other health aspects. And so there's some evidence for that here. So now I want to shift topics and talk about the ketogenic diet and just describe it in more depth and look at the research with brain cancer and where that's going. So the ketogenic diet is a high-fat diet. It's about 90% fat. It's adequate to low protein and low carbohydrate and a calorie-restricted diet. And so you'll see here 3 pies. The classic ketogenic diet is a 4-to-1 ratio. So that means there's 4 times as much fat as there is carbohydrates and protein combined in terms of the calorie composition. There's 5 different versions of the ketogenic diet, and they go from 4-to-1 to 3-to-1 ratio to the least restrictive is the modified Atkins diet, which is more like a 1-to-1 ratio. There's 1 time as much fat as there is to the combination of protein and carbohydrates in a modified Atkins diet. So a classic ketogenic diet, typically the carbohydrates are going to be as low as about 10 grams a day. So an apple has about 15 grams of carbohydrate, so that's a very, very low carbohydrate diet on a classic ketogenic diet. A modified Atkins has up to about 20 grams of carbohydrate per day. And when we think about like the typical ketogenic diet that's very popular it's not like a traditional, but the type that's popularized in the media for weight loss these days, those tend to be around 50 grams of carbohydrate per day. So a real ketogenic diet is specific, a lot more restrictive than that. And comparing it to a standard dietary guidelines type of diet, the American dietary guidelines, about 50% of our calories are coming from carbohydrates, 50% carbs, 15% protein, and 35% fat. So it's quite different. This is just an example of a modified 3-to-1 ratio for a ketogenic meal. So a 3-to-1 ketogenic diet, they call a modified ketogenic diet. This would be a lunch with some avocado and tomato, hazelnuts. You'll see that there's a pickled egg, and then there's a nice blob of mayonnaise on it, because the goal is we need the fat to be high enough, right? So that the calories are high enough. There's some celery with cream cheese added, and then there's a pate that's made from, I think it's liver, pork meat, and fat is the Ardennes pate and celery. And so the overall ratio of this meal would be about a 3-to-1 ketogenic diet type of meal. So what is the background? So why are we talking about the ketogenic diet? Well, it's been used since the 1920s as a supervised medical treatment for refractory epilepsy in children. And the diet mimics the aspects of starvation by forcing the body to burn fat rather than carbohydrates. And so with little carbohydrate in the diet, the liver converts fat into ketone bodies. And the ketone bodies can pass into the brain and replace glucose as an energy source. And so there's recent interest in using this as a therapy to complement traditional cancer treatments, such as radiation and chemotherapy. And it's largely based upon a metabolic theory known as the Warburg effect. So this effect is that it's hypothesized that unlike normal cells, cancer cells can't use ketone bodies for energy. They can only use glucose for energy. And it's believed that the glucose restriction may slow cancer cell progression or slow cancer cell growth. Another theory with the ketogenic diet is that ketones are potentially toxic to cancer cells or may cause changes in genes involved in tumor growth. And so there's some emerging research that's been being worked on for several years now, mostly in animal models, and then there's limited case studies in human that suggest that a ketogenic diet may inhibit the growth of tumor cells and may protect normal tissue in conjunction with standard therapy. And the main interest in terms of types of cancer are with brain cancer and ketogenic diets. That being said, there was an interesting article that was published in the Journal of Medical, I can't even, Oncology, JAMA Oncology, in 2022. And this was basically comparing a whole foods diet and a ketogenic diet and how they potentially have a lot of overlapping mechanisms of having anti-cancer mechanisms. So you'll see everything in purple. Both of the diets can accomplish. So things like lowering glucose levels, lowering weight, lowering insulin, and decreasing inflammation. The variations come from the whole food plant-based diet having a stronger effect on, the phytochemical or phytonutrient intake that we've talked about, those important compounds. Also potentially, the higher fiber content could be very beneficial for intestinal cancers and also for removing carcinogens through our digestive system, and potentially increasing our intake of or production of butyrate, which is a short chain fatty acids that our microbiome produces that has some protective effects against cancer. And then on the ketogenic side, the difference, what you wouldn't get from a whole food plant-based diet, is the production of the ketones, which possibly are toxic to cancer cells. So it's just interesting that there's a lot of overlapping mechanisms. So, the ketogenic diet is a very restrictive diet, and possibly we can do similar things in terms of an anti-cancer diet with these core nutrition strategies and a more whole foods plant-based diet. We really need to know more because the ketogenic diet is restrictive. It needs to be carefully planned, and it can be very difficult and hard to follow. That's not to say that I haven't talked to many people that have been able to do it, but it's a very, it's a restrictive diet and it limits a lot of foods. And there's a long list of potential side effects. So things like digestive issues, fatigue, kidney stones, rapid weight loss, dehydration, nutritional deficiencies, and then effects on lipid profiles and potentially pancreatitis can be associated with the ketogenic diet. And one of the ways for people that are going to be on a ketogenic diet to mitigate some of those side effects is to have a dietitian that's an expert or that knows a lot about a ketogenic diet to support the implementation of the diet and to provide ongoing nutrition counseling, to provide micronutrient supplementation recommendations and medical monitoring. So recommended labs, because all of that can help the diet be more manageable and can help reduce those side effects. And to date, in the small studies that have been done with cancer patients, no major adverse events have been attributed to patients following a ketogenic diet. So far the studies have found out that it's seems safe for people to be following it if they're being monitored and if they're being supported in a study or with a dietitian. And there are several studies underway to determine if the ketogenic diet actually does complement brain cancer treatment. And if so, figure out really the best way to do the diet in this setting. So how long would people need to be on the diet? Could they do it just while they're in treatment? Is it a long-term diet that needs to be followed, if it's even found to be beneficial? And so there's actually a new study here at UCSF. We're one of 5 sites. It's a phase 2 study on the ketogenic diet, and they're going to be doing a 3-to-1 ratio versus a standard diet for patients with newly diagnosed glioblastoma in combination with standard of care treatment. So I think they're enrolling patients that are post-surgery but haven't started chemotherapy and radiation yet. So more to come. We're going to continue to learn more about this diet. But at this point, their evidence isn't really there yet to support it. And just quickly wanted to touch on intermittent fasting because the review article says that this is another research area of interest. And there are, a lot of potential benefits to intermittent fasting, supporting something called autophagy, which is cellular cleaning and recycling of our cells and our immune cells in particular. Some studies have shown that it can slow immune system aging and lower inflammation and lead to fewer pro-inflammatory markers, decreasing something called inflammaging. Most of the research at this point is on animal studies, but again, there's more research building in human studies. And if somebody was to do intermittent fasting, there are quite a few different types of regimens out there, anything from intermittent fasting to time-restricted eating to alternate day fasting. And we don't really know what the best one is yet. I tend to encourage people to think about maybe doing a time-restricted eating pattern to start with. And this would be, consuming calories within a defined range of time, such as between 7 a.m. and 6 p.m., and then fast the rest of the day. So what this gives us is about a 13-hour fast and 11 hours of eating. And some research has shown that some of the benefits of fasting do kick in at that point. So it doesn't necessarily have to be an extended fast. And, in a study looking at women that had breast cancer, it actually showed that having this 13 hours between their last meal and their first meal the next day reduced insulin, it decreased inflammation, and so potentially has some of those benefits to targeting those cellular processes that are linked to cancer. If you're thinking about trying intermittent fasting, I have this approach it with time, and basically just to think about talking to your healthcare team just to make sure that it's not contraindicated with your medications or any other conditions that you may have. Typically wouldn't recommend it, for somebody that has a really low body mass index, having difficulty eating, has a history of an eating disorder. But investigate strategies. So look at all of the different types of fasting, make a plan, and then ease into it. And so that's why I like to start with maybe that time-restricted eating pattern is one way to start doing some kind of intermittent fasting and getting some benefits right away, but letting your body get used to it. So in the last few minutes, I'll cover a little bit about supplements. So first off, the American Institute for Cancer Research, which is the organization that works with the World Cancer Research Fund to study how food, nutrition, physical activity, and lifestyle interact with cancer. And they review studies and make recommendations. And they actually recommend against using supplements to lower cancer risk or to lower cancer recurrence or progression because overall, the evidence of benefit is lacking. Primarily getting nutrients from food has been shown to be much more beneficial whenever possible. And then in some cases, they've seen an increased risk with supplements. One example would be former smokers that were taking high-dose beta-carotene supplements had an increased risk of developing lung cancer. And there's other examples. That being said, supplements may be helpful for other reasons. And so they're not saying, don't take supplements, but not specifically for the reason to lower cancer risk or progression. So first thing is, again, I would always recommend discussing with your healthcare team supplements that you're taking because just because something is natural doesn't mean that it's safe for you to take. And always recommend to learn about possible supplement drug interactions before starting a supplement. And then using products that have been tested for purity and potency. And there are some organizations that will test supplements for purity and potency, and so that you're getting what's on the label, that the ingredients are safe. It's not, doesn't have heavy metals in it like lead or cadmium. And so looking for labels like NSF or USP are very good to look for on your supplements. And then Consumer Lab is an organization that you can sign up for their service and look at supplements that have been approved that they've tested. So looking at dietary supplements for fatigue and memory and cognition, there's actually little evidence that supplements do improve cancer-related fatigue or cognitive function. I just saw a report that Prevagen, which is a memory supplement, got cited by the FDA because their claims are not, there's no evidence to support their claims for memory. Just a side note, but the strongest improvements really have been seen with nutrition, physical activity, and sleep. But one thing I would recommend is to think about potential vitamin mineral deficiencies that may affect memory and fatigue. So even though just taking the supplement may not be beneficial, if somebody has a deficiency for something, that could absolutely be linked with memory and fatigue issues. In particular, the B vitamins, vitamin D, iron, and magnesium, all can be associated with deficiencies affecting memory and fatigue. And certain medications, again, kind of going back to the anti-epileptic medications that can actually deplete levels, certain B vitamins and vitamin D levels. So thinking about that as well, recommend, if possible, to check blood levels for those deficiencies or insufficiencies before supplementing whenever possible. Because if the B12 level is normal, supplementing with B12 is probably not going to have any effect in terms of improving energy or memory or cognition. But if there's a deficiency, it absolutely could help. So ideally, having blood tests to check for that first. If eating poorly or on a restrictive diet, specifically like a ketogenic diet, for example, where there's a lot of foods that are restricted, we recommend considering a high quality multivitamin. Additional support for both fatigue, memory, and cognition may include omega-3 fatty acids, vitamin D3, magnesium glycinate. American ginseng may help with cancer-related fatigue. And then phosphatidylserine, which is a fatty substance that covers and protects the nerve cells in the brain, enables them to communicate with each other, may help with age-related cognitive decline. And I'm not recommending any of these supplements across the board, but these are things that I would consider as potentially beneficial. So in summary, good nutrition is an important part of cancer treatment and survivorship, and integrating nutrition with exercise and stress management techniques into the daily life will support the immune system, promote wellness, improve energy, enhance treatment, and something that you can leverage to think about taking control and making your body more of an anti-cancer environment. And the goal is daily practice versus perfection. So when we talk about exercise or meditation or yoga, everybody talks about practicing things, not being perfect. And I think we don't say that enough about diet as well. So just, every meal can be an opportunity to practice healthful eating habits. We're not always going to be perfect, and it doesn't have to be. So just sort of thinking about practicing on a daily basis. And lastly, you will get this presentation, so you'll have these resources, but I've just included some cookbooks and some websites that I think are particularly helpful. And I'm going to stop the presentation because we have about, I think, 20 minutes for questions. So thank you all for listening, and I'd love to take some questions.